So welcome to the lesson. Hope it's going to be a fun one. So we'll be doing two viruses, parvovirus and poxviruses. Okay, so parvoviruses are the smallest of the DNA viruses belonging to the family Parvoviridae. Okay, so remember we've been doing DNA viruses, RNA viruses. If you can remember the DNA viruses, we had herpes virus, pox virus, hepatitis B, adenovirus, HPV, which I also did. And then we also have the parvovirus. So they are icosahedral, non-enveloped viruses containing a single-stranded DNA, okay? Non-enveloped meaning they're naked and they're single-stranded DNA. So you'll notice this is the only single-stranded DNA virus. So the rest are double-stranded. And then we have hepad-DNA, which is hepatitis B, is partially double-stranded, okay? So take note of that. Human parvovirus B19 is the only known parvovirus that is pathogenic for humans, and it shows tropism for erythroid progenitor cells. So I'm going to explain this, what this statement means as we continue. So a brief history. In 1974, Cossat et al., so this is our research, first identified B19 while evaluating tests for hepatitis B virus surface antigen. The name originates from the coding of the serum sample, number 19 in panel B, that gave anomalous results when tested by counter-immunoelectrophoresis and radioimmunoassay. So this is just a bit of history so that you know why it's called parvovirus B19. Okay. Classification. So parvovirus comes from the family of Parvoviridae, consisting of 3 genera. We have Dipendovirus, Parvovirus, and Erythrovirus. The genus Dipendovirus consists of pox viruses, which are defective and replicate only in association with the second helper virus. They neither cause illness by themselves nor alter the infection caused by helper viruses. These are usually found in association with adenovirus, hence the name, also known as adeno-associated viruses. These viruses do not cause any disease in humans, okay? They depend on viruses. The genus Parvovirus includes the virus which include animal viruses of veterinary importance, such as fenyl panleukopenia virus and canine parvovirus. So we said that in parvovirus, we're interested in B19, since it's the only one that affects humans. Okay, so let's start on parvovirus. So parvovirus B19 or B19 virus is a causative agent of erythema infectiosum, also known as fifth disease. So this is something you'll hear. People usually call it fifth disease or erythema infectiosum. Okay, so when you hear the word fifth disease in your exams or anywhere you interact with patients, just know that is parvovirus. It was the fifth of the 6 classified exanthematous diseases of childhood. A mild viral illness of children, a polyarthralgia, arthritis syndrome in immunocompetent adults. Okay, so this statement is very important. I'm going to reiterate it. In children, it mainly causes the rash, and in adults, it mainly causes arthritis. So the famous ones we know are chickenpox, roseola. So roseola is HHV6, measles, rubella, and fifth disease. All these cause maculopapular childhood rashes. Okay. Human infection caused by parvovirus B19. So normally parvovirus, when you're infected with parvovirus, it usually starts the flu-like illness. So you'll have malaise. So malaise is also called fatigue, where you're fatigued, you just feel tired or lethargic, headache, myalgia. So myalgia is muscle pain, and rhinorrhea. So rhinorrhea is basically production of mucus. So what you usually get during a flu. So what we call rhinorrhea. Erythema infectiosum, so which is the rash. So erythema means red. So cutaneous rashes and arthralgia. We said rashes in children, arthralgia and arthritis is in adults. And also a plastic crisis. We're going to explain what a plastic crisis is. Then infection in pregnant women, Reinfection in a pregnant woman, no adverse effects. Non-immune seronegative pregnant mothers. So seronegative means that they don't have HIV. Their children usually get hydrops fetalis, or which can lead to fetal death. Okay. Then chronic B19 infection, we have chronic anemia, leukopenia, and thrombocytopenia. So these table, you have to know it. So this is the most important thing in symptomatology of parvovirus B19, okay? But you're going to go in depth in each of these diseases. Morphology, B19 are extremely small viruses, as we had mentioned. They are the smallest DNA virus, okay? So you have to know that. While we're going to do pox virus, you'll notice pox virus is the largest DNA virus, while parvovirus is the smallest DNA virus, measuring 18 to 26 nanometers in diameter. So you can't even see this with microscopy. You can't. It's very small. Considering an RBC is around, is it 72,000 or 7,200? I'm not sure, nanometers. So you can imagine how small this virus is. It possesses a non-enveloped, so it's naked, icosahedral capsid. So we're going to see it. The viral genome contains a single-stranded DNA. The only single-stranded DNA virus, measuring 4,000 to 6,000 bases in length. The genome is negative strand DNA. The genome encodes for many proteins, which include 3 structural, 1 major non-structural, and several smaller proteins. Okay, that's the morphology. Replication. So in replication, let's see, okay. So in replication, one thing you should know about parvovirus is, let's see if I have a picture. Yes, I can explain here. How we get it. So it is spread by respiratory droplets. Okay. So if you cough on a surface, then I touch that surface, I might get this parvovirus. Or you cough, then I inhale those respiratory droplets, I'll get it. So the virus in the upper respiratory tract, what happens is there'll be local replication. So one thing I want you guys to understand is pathogenesis does not occur in the respiratory system. As much as, yes, you get it via the respiratory system, but replication occurs in erythroid precursor cells in the bone marrow. Okay, so we know how RBCs are produced. So there are stages of RBC production. I'm sure you've heard of reticulocyte. So reticulocyte is usually the stage before we get the RBC. So you see all those precursor cells, or the cells before RBCs are produced in the bone marrow, is where viral replication will take place. Okay. So let me draw, so I'll explain to you. If this is an immature RBC, they are usually draw them here. They're usually antigens on the surface of the RBC, okay? Remember, these are the immature ones. So this is how the antigens look like. So they're called P antigens, okay? So the parvovirus will come, attach itself on the surface of the antigen here, the P antigen. And these P antigen are found in the precursor cells of the bone marrow, okay? Now, when this happens, it leads to viremia. So viremia, as we had said last time, virus in blood, bacteremia, bacteria in blood, fungemia, fungi in blood, okay? So if we can put this. So B19 shows tropism for A, bone marrow cells, B, erythroid cells from fetal liver, and C, erythroid leukemia cells. So all these are the precursor cells of RBCs. Replication of virus occurs in the nucleus. So remember, as during the introductory lectures, we said all DNA viruses replicate in the nucleus except for pox virus. Okay, All DNA viruses replicate in the nucleus except for pox viruses, which replicate in the cytoplasm. How I used to remember when I was studying, I used to say pox is out of the box. So pox is out of the box, where the box is the nucleus. So it's out of the box. So if it's not in the nucleus, within the cell, it's in the cytoplasm. The single-stranded DNA genome has hairpin loops at both of its ends, which facilitate double-stranded areas for the cellular DNA polymerase to start synthesis of the progeny genome. So this is the replication process. The cellular RNA polymerase synthesizes viral mRNA from the double-stranded DNA intermediate. This is followed by assembly of virions in the nucleus. Viral replication results in cell death. So we have a picture. So basically, this is the replication. They usually don't ask questions on replication, but if you were to get something from this, we said that these are single-stranded DNA. So what happens at first? It has hair loops at both of its ends. Okay, ignore that. Facilitating double-stranded areas for cellular DNA polymerase to start synthesis of progeny genomes. So basically, we have DNA, which will be converted to RNA, then RNA will be converted to protein, okay? That's the most important thing you should remember. Only one serotype of B19 is known to occur. Other properties, B19 is highly resistant to inactivation, but can be inactivated by formalin, beta-propiolactone, and oxidizing agents. So as you can see, it's a naked virus. So if it falls on the surface, you can easily get it, okay? It can withstand heating at 56 degrees for 30 minutes and stable between pH 3 and 9. So you can see how stable this virus is. Pathogenesis. Parvovirus shows atropism for two types of cells. So RBC precursors, so the immature red blood cells, and endothelial cells of the blood vessels. The virus infects rapidly dividing erythrocyte precursors, such as bone marrow cells, erythroid cells from fetal liver, and erythroid leukemic cells, and destroys these cells after infection, thereby causing aplastic anemia. So here, can you see at the point of replication? So that is where the replication is occurring. So when viremia, as you can see this arrow, when it's a normal host, there'll be a slight drop of hemoglobin level. So the normal HB level or hemoglobin level is usually 12 to 16 in female, then 13 to 18 in male. So if you're normal, or there'll be a slight drop in hemoglobin level. But if you're a host with chronic hemolytic anemia, there'll be life-threatening aplastic crisis. So aplastic, meaning your bone marrow is not producing a lot of RBCs, okay? So this is a patient who already has a history of chronic hemolytic anemia. Then we have, when viremia occurs, there'll be viral replication in the upper respiratory tract. Then, as I had said, there'll be the rash, mostly in children, as you can see here. We're going to describe it. Then arthralgia, which means joint pain in adults. It also causes arthritis. So arthritis is inflammation of the joint. So infection of the endothelial cells in the blood vessels leads to erythema infectiosum. It has been demonstrated that the B19 virus first enters through the nasopharynx or upper respiratory tract, then spreads in blood, causing viremia, as you can see in this arrow. Then the virus then infects mitotically active erythroid precursor cells in bone marrow and establishes the infection. Okay, so this is a very high-yield topic for you to understand. Okay, so to summarize, virus in the respiratory tract, there'll be, we said it's interested in the bone marrow cells, so it goes up to the bone marrow, replicates in erythroid precursor cells. Then when that happens, there'll be viremia. The virus goes to blood. When the virus goes to blood, it will cause rash in the children, or arthralgia in adults. Then for a normal host, we expect a slight drop in hemoglobin level. But if the patient has chronic hemolytic anemia, we'll have life-threatening aplastic crisis. So in chronic hemolytic anemia cases, some that you may be familiar with is, for example, sickle cell disease. We also have thalassemia. We also have hereditary spherocytosis. So those are the people. So if a patient who has sickle cell disease develops parvovirus B19, they'll have aplastic crisis. Okay. So in terms of aplastic crisis, how will they present? So they'll have symptoms of anemia, so pallor, weakness, lethargy, headache, palpitations, things like that. Okay. Then the pathogenesis, the virus enters susceptible cells through the P blood antigen receptors on the erythrocyte precursors. So here, as I had drawn. Inside the red cells, the virus enters the nucleus, starts replicating, followed by killing the red cell. So what happens is, once it enters the nucleus, replication starts occurring. So many viral copies are made. And when that happens, finally, there'll be apoptosis of the cell. Okay. And when this happens, it goes, viremia happens because the virus will now start entering the blood. So the production of RBCs is stopped for approximately 1 week due to killing of erythroid precursor cells by the viruses. So initial state is associated with flu-like illnesses caused by large viremia. So as we had seen here, where there is, so this is the first stage. When the virus has entered the blood, there'll be malaise, headache, myalgia, and rhinorrhea. As we continue, the viruses are shed into the oral and respiratory secretion and even cross the placenta, okay? So one thing to note is we said in pregnant women, we can have hydrops fetalis, and which can lead to fetal death. So this happens when you have the virus in the mom's blood, which can cross through the placenta. Subsequently, viremia is controlled by the production of specific antibodies against parvovirus B19. So the body, once the parvovirus is in blood, so once viremia occurs, the body needs to get rid of this virus. So it produces the antibodies, usually IgM and IgG against them. The rash and arthralgia present the second stage of the disease and is believed to be immunologically mediated. So you can imagine the body is seeing viruses in the blood. So it starts producing the antibodies, IgG and IgM. Then, coincidentally, the rash appears. And the rash in children and the joint inflammation this is joint pain in adults. So this stage coincides with the disappearance of the B19 virus from circulation, appearance of B19 virus-specific IgM and IgG antibodies, as I had mentioned, and finally, formation of immune complexes. Okay? So host immunity, the disease exhibits 2 stages. Initial flu-like illness, which is mediated by the viremia, and the second stage is appearance of the rash and arthralgia, which is mediated by the specific IgM and IgG antibodies. Host immunity to B19 virus is infection is primarily antibody mediated. The circulating antibodies stop the viremia and are important for resolution of the disease. The role of cell-mediated immunity is in conferring immunity to B19 is unknown. So they're still doing their research to get to know the role of that cell-mediated immunity. Clinical syndrome, as we had mentioned earlier, B19 causes the following clinical syndrome: flu-like illness, erythema infectiosum or fifth disease, infection in pregnant women, and chronic B19 infection. This is very, very high yield. Okay, so these are the things you can be asked during your orals or during your sport, where you're told, outline 3 clinical syndromes that parvovirus causes. So will you forget? You start with flu-like illness due to the viremia. So you talk about malaise, headache, myalgia, and rhinorrhea. So think of symptoms you get when you get a flu, okay? Erythema infectiosum or fifth disease. B19 is an additional causative agent of erythema infectiosum or fifth disease, most commonly in children. The infection begins with non-specific symptoms followed by appearance of distinctive rash on the 5th day of infection. So here, you'll be brought for this picture, and they're going to ask you, what is this? So we call it the slapped cheek rash. So if someone slaps you here, you can see you usually get erythema or redness, okay? Can you see? It's called slapped cheek rash. So this is the 5th disease. A bright red rash develops on both cheeks that appear as they have been slapped. Can you see here? The rash then appears on the trunk, which spreads gradually towards the arms and the leg. Okay? This condition usually subsides within 1 to 2 weeks. So have you understood this? Aplastic anemia. So as we had mentioned, transient, which means temporary but severe aplastic anemia can occur in children with chronic anemia, such as sickle cell anemia, thalassemia, and hereditary spherocytosis after infection with B19 virus. Okay, so basically, aplastic anemia, as I had mentioned earlier, is a state where your body is not producing enough RBCs, and it's usually very severe. Gloves and sock syndrome is another serious complication of B19. So in this syndrome, erythematous exanthem appears on the hands and feet with well-defined margins on the wrist and ankle joints. So here's the picture. Can you see? So this glove and sock syndrome is usually rapid of onset. So as you can see here, there is erythema. Erythema is this redness. Can you see this redness? And there is swelling or edema. Can you see this swelling of this arm and this foot? So it extends to the palms and the soles. And then eventually they become petechial. So petechial is when there is damage of the capillaries of this foot, the subcutaneous capillaries. So you'll see dots forming here. These very, very small dots. So these dots, the petechiae, so petechia, these small dots that are here, then pupilla are larger dots. So when they form, multiple of them is now when you'll get this margination. Are you seeing this line of margination? That is due to the multiple petechia and pupilla. Can you see this well marginated line? Okay. So patients will tell you it's usually painful or itchy or burning, a burning sensation here. Okay. And then infection in pregnant women. If the B19 causes reinfection in a pregnant mother who is infected earlier by the same virus and is already immune to the virus, so showing positive B19 antibodies, there is no adverse effects that are seen in the fetus. What this sentence means is, if a mother got B19, when you get B19, remember we said you'll have the flu-like symptoms, then your body will kick in. So you'll start getting antibodies against the virus. But when you have antibodies against the virus, then you get it again when you're pregnant. The fetus will be okay. There is no adverse effects on the fetus. But in non-immune seronegative pregnant mothers, so these are pregnant mothers that have no HIV and they're non-immune, so they did not get it at first, the B19 virus infection is associated with the increased risk of fetal death. So if you're just a normal mother who does not have HIV and you have never got the B19 virus, you're most likely to get hydrops fetalis. The infection may cause severe anemia in the fetus, and subsequently, the fetus may develop signs of high output cardiac failure or hydrops fetalis. So B19 virus, however, does not cause any congenital anomalies in the fetus. So these are one of the perks. Don't know if I call it a perk, but advantages of not getting this. So you'll not have a congenital anomaly. You know, like some viruses such as rubella, they can cause heart conditions in the baby, or what other virus? Some other bacteria, the chlamydias, okay? They can cause any anomalies in the fetus. So B19 does not. Then chronic B19 infection. This infection occurs in immunocompromised patients, such as patients with HIV, those receiving immunosuppressive therapy, and transplant patients. So immunosuppressive therapy, so use of immunosuppressants, so drugs like azathioprine, drugs like that, they are immunosuppressive, and transplant patients. So these are people who are very immunocompromised. So if they get the disease, they're going to have things like chronic anemia, leukopenia. So chronic anemia are like the sickle cells. Leukopenia, so low leukocyte levels, and thrombocytopenia are common manifestations. So this is low platelets in blood. Okay. I should have put this slide earlier, but the epidemiology, B19 is distributed worldwide. Exact data on seropositivity in population world over is not known. So patients who have HIV and B19 at the same time, the exact data is not known. So approximately 90% of adults older than 60 years are seropositive in United States. Similar data from other parts of the world are lacking. So B19 virus infection is strictly a human disease. So it is not zoonotic, only affects humans. Humans are the only reservoirs of infection. Viruses are excreted in respiratory samples, which are the primary source of infection, as we had mentioned. Then, ways it's transmitted. Infected patients is contagious from 24 to 48 hours before developing prodromal syndrome till the appearance of the rash. So the prodromal syndrome here is the flu-like symptoms. The infection is transmitted by, so vertical transmission during birth, respiratory route through respiratory secretions, and percutaneous exposure to blood and transfusion of blood with blood products. So blood products are like the RBCs, platelets, WBCs, intravenous immunoglobulins. Okay. Yeah. So you have to remember these three. So vertical transmission via the placenta, respiratory route, and blood transfusion. Diagnosis. Demonstration of specific IgG and IgM antibodies in the serum is useful for diagnosis of erythema infectiosum caused by B19 virus. Okay, so that's how we usually do. Take a sample, measure the levels of antibodies against B19. So we can use ELISA, radio immunoassay, and indirect fluorescent antibody for demonstration of IgG and IgM antibodies. In pregnant women, the serum positive for IgG and IgM antibodies indicate B19 infection within 7 days to 4 months, and a possible risk of to the fetus. Positive IgG but negative IgM results indicates only past infection, hence no risk of the fetus. So you'll do this in immunology, where we know IgG is for chronic infections. Then IgM is a marker for acute or an active infection. Okay, so if it's positive for IgG, but IgM is negative, we know that this is person who had the infection long time ago. Further, PCR is available to demonstrate B19 virus genome in blood. So if you're interested to see that, to see the DNA of parvovirus, positive results suggest viremia or infection. So to summarize this slide, we use ELISA to get IgG antibodies or PCR to get the viral DNA. Okay. Treatment, non-treatment. So treatment is usually symptomatology. There are no specific measures available for prevention of the infection. But generally, if you are to check how it's transmitted, So respiratory route, how do you prevent respiratory route? How do you prevent transmission through respiratory route? So social distancing, wearing of masks, things like that. Then for blood transfusion, so screening of blood and their blood products. Development of a vaccine against B19 is undergoing phase 1 clinical trial. Okay. So do you have any questions on parvovirus B19? So normally the questions that I've seen mostly is they'll bring a patient like this, then they'll ask you what disease manifests in adults. So if you're in a hurry, you'll just rush to slapstick, or you mention fifth disease, but the answer is arthritis. Okay, so adults, remember arthritis and arthralgia. Children, fifth disease, so the slapstick appearance. Then for arthritis in adults, one thing you have to remember is the arthritis is symmetrical. Symmetrical meaning it affects the joints of both limbs. So the left hand, the right hand are affected, left leg are affected, and it usually affects the small joints. So fingers, hands, ankles. It can also extend to the knee. So the hip is paired, shoulder is paired, elbow is paired. Okay. Yeah. Any question? Poxviruses. So we said parvovirus is the smallest DNA virus. Now we're on the largest DNA virus. Okay. Okay. So we start. So in terms of structure, poxvirus is the largest DNA virus. It's double-stranded DNA. Remember we said all of them are double-stranded DNA except parvovirus is the only single-stranded DNA virus. It is brick-shaped, or it has a dumbbell core. Can you see this? This is the core. Also, can you see my pointer? So here is the core. You can see it's dumbbell shape. So dumbbell, for those who go to the gym, you know how the dumbbells look like. Yeah. So this is where it contains the nucleic acid. Then the lateral bodies are here. They have an unknown function. Then you see it's brick shaped. It's enveloped, meaning resistance to inactivation. Compared to parvovirus, which we said it's naked, more than 100 polypeptides mainly target the immune response. Then it replicates in the cytoplasm. Remember, we said all DNA viruses replicate in the nucleus except the pox virus. Remember my mnemonic for remembering? Pox is out of the box. Okay. So the box in that case is the nucleus. So it tends to be highly species specific, meaning that one will affect human beings, another will affect a certain species. Okay. Some are being explored as gene therapy vectors. Okay. So the family is Poxviridae. We have subfamilies, Poxvirinae, orthopoxviri. So here we have variola, which is the smallpox, vaccinia, cowpox, monkeypox, camelpox. So all these are for the animals. Then what we're interested in is mollusca poxvirus, which causes molluscum contagiosum or contagium. Okay, that's our main interest. So we're interested in variola, smallpox, monkeypox, and molluscum contagiosum or contagium. The rest you can ignore. Poxvirus include the human virus variola, which is smallpox, and molluscus contagiosum. Some viruses naturally infect animals and can cause incidental infection in humans, which is called zoonosis. Many of these viruses share antigenic determinants with smallpox, allowing the use of animal poxvirus for a human vaccine. Okay, so this is very important. We're going to see the development of the smallpox vaccine and how it was derived from animals. So as you can see, it is the largest virus, almost visible on light microscopy, 300 nanometers. Compared to the other one, we said it's 18 nanometers. Are ovoid to brick shaped, as you can see here, with a complex morphology. Replication. So for this, let me look for a diagram. Yes. So I prefer to explain using a diagram because it's easier for you guys to understand. So here's the virus. It has the envelope, the core protein. So what happens is it has to attach itself. So this is the cell. This is the cell membrane. This is the cytoplasm. This is the nucleus. Okay, so I hope you've understood that. So the virus, it just can't just enter a cell. So it has to attach itself. Okay. Normally, it's not in the diagram, but there are usually receptors here. So what happens is the variola virus attaches its cell on specific receptors. Then it binds. So bounding will happen here. Then when that happens, it will enter the cell through a process called endocytosis. As you can see here, adsorption, penetration. So the penetration that they're talking about is called endocytosis or the fusion. Once it fuses, the viral envelope, this one. So the viral envelope fuses with this host cell membrane. And the core part of this virus will be released. And one thing you have to remember is this core contains the DNA. So it will be released inside this cytoplasm. Okay, as you can see here. Now, I want you guys to remember some biochemistry. So there are a lot of biochemical reactions happening here, but I'm going to simplify this diagram. Number one, there'll be transcription. If you can remember, transcription is the process of converting DNA into RNA. Then translation is the process of RNA into protein. So basically that's what happens here. Okay, so we have something called early transcription and late transcription. Let me explain. So this virus, it has some enzymes in its core. Okay, so one enzyme that it has is called RNA polymerase. Okay. Okay, so it's called RNA polymerase. So what happens here, this RNA polymerase will begin transcribing. We said transcription is the process of DNA to mRNA. So it will begin transcribing. They're called early genes. So these early genes, they'll be transcribed from DNA to mRNA. Okay. Then what will happen is this DNA, as you can see here, transcription has happened. Then you're going to get from DNA to RNA. Then what happens here? Here there'll be okay, sorry, let me start again. I think I got confused. So we said that there's going to be transcription, and we said transcription is from DNA to RNA, as you can see here. Now, what happens is after RNA, we are going to translate to protein. Now, the protein is the enzymes and the viral proteins. Okay. Then I want you to ignore the late transcription a bit. What happens in this stage, there's going to be virion assembly. So these virion proteins, they're going to assemble here. They are newly synthesized viral DNA. Okay. So what happens here, the late proteins are going to combine with the viral DNA, this. Okay. And they will assemble within the cytoplasm. And then changes will occur where it becomes a new virus that has replicated within this. Then it's going to be released outside the cell. Okay. Okay. So in this process, there's a lot of biochemical reactions happening here. Late gene transcription, then late mRNA, late enzymes. The process is still the same. To summarize this, just remember, there'll be DNA will be converted to mRNA, mRNA will be converted to protein. Then when that happens, they're going to join together, leading to formation of the new virus. Then exocytosis happens. So removal of this virus. Okay, all this is not relevant. The biochemicals, things that are happening in here, it's not that relevant. Just remember that DNA will be transcribed to RNA, RNA will be translated to protein. Then the protein will form together, morphogenesis happens, then the virus is released. Okay. So this is what it was saying. Maturation, structural proteins are synthesized, virus synthesizes its own membrane. Some virus exit by budding, but most when the cell dies. So what happens is viruses will be produced here, apoptosis occurs, boop, it bursts, then these ones are released. Or it can be released through exocytosis. Pathogenesis. After being inhaled, smallpox replicates in the upper respiratory tract. Dissemination occurs via lymphatic and cell-associated viremic spread. Internal and dermal tissues are inoculated after a second viremia, causing the simultaneous eruption of characteristic pox. Okay, so I'm going to show you a picture. These ones, can you see them? Okay. Molluscum contagiosum and other pox viruses, however, are acquired through direct contact with lesions. So I'm sure you've heard of the story about monkeypox. It's usually acquired through direct contact. So a patient who has molluscum contagiosum, you get direct contact with them, you get the disease. But for smallpox, it's through respiratory droplets. Okay. So here it is, the virus, inhalation or transmission by scabs, then multiplication in the upper respiratory tract, then through the lymphatics, goes to the lymph nodes, then primary viremia in blood, hemorrhage of small vessels of the dermis leading to rash and the pox. Okay, it can either go that direction or it can affect the major organs like the spleen, liver, bone marrow, additional lymph nodes. So as you can see from day 0, when you get the virus, multiplication here till somewhere till day 12. Then here's where you get the fever and the rash. Then from day 16, we have the formation of the pustules, as I'm going to show you. Okay. Epidemiology. These are strictly human viruses, smallpox and molluscum contagiosum. In contrast, the natural hosts for the other pox viruses important to humans are vertebrates other than humans, for example, cow, sheep, goats. The viruses infect humans only through accidental or occupational exposure. That is zoonosis. Okay. Then smallpox. Named smallpox to discriminate it from large pox, which is syphilis. Can Can you see these? So these are the we call them the vesicles and the scabs. So here, clinical progression. So progression of these lesions usually start with macules, day 2 to day 3. Then they go to papules, 3, 4, 5. Then they become vesicles, as you can see here. Then scabs. Then as your body fights it, go back, you can see the skin is returning to normal. So the progression is, you start with the macules, then papules, then vesicles, then scabs. Okay. So normally what happens is there's sometimes where they can cause scarring. So basically these scabs become permanent and they form scars throughout you can see the face. So the progression for the lesions, they usually start in there. Remember we said they start from the oropharynx or the respiratory system. Then they go to the face, extremities, which is the arms and the fingers. So the extremities, which are the hands and the legs. Then they go to the trunk. So I don't have a picture here, but the trunk is the abdomen region. Then they usually finish off the last place, usually the palms and the soles of the feet. Okay. Okay, so oropharynx, where you get the respiratory droplets, then the face, extremities, trunk, then palms and soles of the feet. So the main species of smallpox, so we have said there's no animal reservoir, is variola major, which causes 20% fatality, and variola minor. So smallpox was a really, really bad disease until it was eradicated, I think, in around 1970. It killed 300 million people in the 20th century and fatalities probably near 1 billion. So as you can see, it was a very, very bad disease. So thanks to vaccines, this disease was eradicated. You will never see this disease in your clinical practice. Okay, but we just have to know. So I will come back to this slide. So pathogenesis, as we said, respiratory transmission. Incubation period, 10 to 14 days. After day 7 or so, human beings begin shedding virus asymptomatically. So principal reason for rapid spread. So outbreaks tended to be in clusters. So in terms of clusters is like if you're in an enclosed place, like the dormitories or classrooms, okay? So where you share commodities with people. Allowed the ring immunization containment strategy during eradication program, okay? So for clinical symptoms, we have fever, malaise, and then distributed exanthems, which are the macules, papules, and the pustules, as I had mentioned. So here they are. Then we come here to control and eradication. So the vaccine, it was a very interesting way how the vaccine was developed. Edward Jenner observed that milkmaids rarely contracted smallpox. Okay, so milkmaids are people who used to, back in the early days, people who used to milk the cows. So you wondered, why are these milkmaids not getting smallpox? So all had recalled earlier cowpox infection, which were nearly universal in milkmaids. Okay, so you noticed that these people, they're not getting smallpox, despite the fact that many people in the population, as we had said, 1 billion people had been affected. But these milkmaids, they're not getting smallpox. But he noticed that these people are getting cowpox. And this cowpox, it only causes a mild infection in humans. So he hypothesized that the infectious agents of cowpox protected against smallpox. So he became sacrificing. So inoculated a nephew by scarification with cowpox crusts termed variolation. So that is how the vaccine was developed. So through the cowpox crust, inoculated the nephew, and he saw that it became protective. So he noted that the cowpox was protective against smallpox. Today's vaccine is live attenuated vaccinavirus. I mean, that is what was used until cowpox was eradicated. But so vaccina genome looks similar to cowpox, but it is not identical. So in the 1950s, the Soviets proposed a global eradication program to the United Nations. Some have suggested that the Soviets had a vaccine-resistant strain of variola, which could be used as a bioweapon. The World Health Organization intensified smallpox eradication program, which began in 1967. Smallpox was eradicated in 1980. The last case reported was in 1977. Only 2 nations are supposed to have smallpox viruses today. The United States through the Center of CDC, the Center of Disease in Atlanta, and Russia, Vector Moscow. Okay, so don't worry about smallpox. Not a disease that is there, eradicated in 1980. We had seen this. Vaccina. So vaccina, a form of cowpox that was used for the smallpox vaccine. The vaccination procedure consisted of scratching live virus into the patient's skin, then observing for development of vesicles and pustules. Encephalitis and progressive infection, vaccina necrosum, the latter occurring occasionally in immunocompromised patients. Okay, so we saw that use of cowpox was protective against smallpox. So ORF, cowpox, and monkeypox. Human infection with ORF, poxvirus in sheep and goat, and cowpox, vaccinavirus, usually an occupational hazard resulting from direct contact with lesions on the animal. A singular nodular lesion usually forms on the point of contact, such as the fingers, hand, and is hemorrhagical granulomatous. Okay, so this poxvirus of sheep and the cowpox, it's usually an occupational hazard. So herders, farmers, or people who keep animals are people who are most likely going to get it. Then it regresses in 25 to 30 days, 35 days, generally without scar formation. The lesion may be mistaken for anthrax. So you're going to do anthrax. It's a type of bacteria caused by Bacillus anthracis. So quite similar. Then monkeypox causes a milder version of smallpox disease. So I didn't put the slides on monkeypox, but monkeypox, as of now, it's while we were doing virology, that was around 3 years ago, it was not that important. But now, as you can see, monkeypox has become a really, really big thing. So maybe I can mention 1 or 2 things about monkeypox. Just a minute before we do molluscus contagiosum. So for monkeypox, similar to smallpox, remember we said the rash, it progresses from macules, then papules, then vesicles, then pustules, then scabs, okay, or the scabs. Let me write for you down on the chart so that you don't forget. Starts with macules, then papules, then vesicles, then pustules, then scabs. Okay, so remember that. One thing about monkeypox, if you were to check a picture, let me show you real quick. Can you see my screen? This. Can you see this? This.
Yeah.
Yes. So these are the lesions of monkeypox. Very characteristic. So in case they bring this image on the exam, you're going to know that these are the monkeypox ones. Okay. You can see in this hand. Look at this man from progression. Can you see? Oh, sorry. Sorry. Can you see? This is in a neonate. Okay. So if they bring this, you're going to know it's monkeypox. Okay. Can you see? Yeah, this
Sorry,
one.
you're not sharing now.
Oh, sorry, let me share. Can you see now?
Yes.
Look at the size. Okay. And we know it's transmitted through close contact. They can bring a picture like this. Then they ask you how the mode of transmission. So you'll answer close contact. And then for the symptoms, we can read here. Transmitted to humans through close contact with an infected person or animal, or with material contaminated with the virus. Monkeypox is transmitted from one person to another by close contact with lesions, bodily fluids, respiratory droplets, and contaminated materials such as bedding. Monkeypox symptoms: fever, headache, muscle ache, and backache, swollen lymph nodes, chills, exhaustion, a rash that can look like pimples or blisters on the face, inside the mouth, and other parts of the body like the hands, feet, chest, genitals, or anus. Monkeypox is rarely fatal. Okay, so take note of this. They can just lift this question and ask you guys. Something to mention is there are not exactly any antiviral therapy for monkeypox. So treatment is usually supportive. So if they have the pain or the fever, you give painkillers. For the fever, you give, we call them antipyretics. So antipyretics are the fever lowering medication. Okay. Yeah, so you tackle the symptom that the virus causes. Okay. And then molluscum contagiosum. So the lesions differ significantly from pox lesions in being nodular to wart-like. Do I have a picture? Sorry, I forgot to insert a picture, but I'm going to show you. So they begin as papules and then become pearl-like umbilicated nodules that have a central caseous plug. The incubation period for molluscum contagiosum is 2 to 8 weeks, and the disease is spread by direct contact. So sexual contact, wrestling, or fomites. So fomites are things like bedding, towels, things that you share through close contact. They are most common on the trunk, genitalia, and proximal extremities, and usually occur in a cluster of 5 to 20 nodules. Can you see here on this picture? Here's a nodule, here's a nodule, here's a nodule, here's a nodule. The disease is more common in children than adults, but its incidence is increasing in sexually active individuals. Diagnosis. So you confirm it histologically by the finding of characteristic large eosinophilic cytoplasmic inclusions, which are called molluscum bodies in epithelial cells. Here they are. Can you see them? This is the epidermis that is filled with molluscum bodies. And then these bodies can be seen in biopsy specimens. So biopsy is where you go, take a part of the part of the organ, most likely the skin. Then the lesions of molluscum contagiosum disappear in 2 to 12 months, presumably as a result of immune responses. The nodules can be removed by curettage, so scraping. You come, scrape this epidermis, or the application of liquid nitrogen or iodine solution. So let me show you a picture of the molluscum contagiosum. As you can see here, you see, we said they usually accumulate from 3, 5 to 20. Can you see here? And in this child at the trunk, and look here, 5 to 20. Can you see here? But it rarely looks like this. So you'll see they form a accumulation like this in someone's face. Okay, can you see here? So this is molluscum contagiosum. Okay.